Well, open enrollment time is here, and there's a lot to consider when trying to figure out which Medicare plan is best for you. Healthcare in the Heartland, of course, can help. Daryl Funkhauser from Aetna Medicare, he joins us today. Good afternoon, Daryl. How are you?
I'm doing good. How are you?
I'm great. Tell us, what is the goal of healthcare in the Heartland?
Oh, it's very simply, it's just a good time for beneficiaries, those that are Medicare eligible, or maybe if they just have questions about Medicare for somebody else, a spouse or a significant other, or perhaps a mother, father, just call in and ask questions. Talk to a licensed certified broker and ask questions.
So people, they'll be watching, of course, at home. How can they take advantage right now
Take advantage of
your open enrollment and
Oh,
the
okay.
services
Well,
you guys helping answer those questions?
there's so many options available. So it's just a good thing to maybe sit down and speak with somebody that's certified and licensed and independent. They represent most of the carriers, if not all. Talk about the options, talk about the formulary, talk about the network, talk about the benefits, and maybe find a plan that's a little better option than what you currently have.
And you all have been doing this for quite some time. I know I've done a couple phone banks with you over the years. Just tell us, there's a lot of pressure right now surrounding that open enrollment. What if you get the wrong plan? What do you do?
Well, you can still make a change up to the close of the annual enrollment period, which ends on December 7th. So it's the last enrollment that you complete or submit, and that's the plan that will take effect on January 1. If you're happy with your current plan, if you don't really want to make any changes, you don't need to, you'll renew into the same plan as of January 1.
Okay, and December 7th, we've got nearly a month to get that open enrollment changed if we need to make those changes. What would you say right now is the most common question that you're getting from people when you're taking those phone calls?
A lot of questions have to do with the Medicare versus Medicaid scenarios, and there's a lot of differences between those two options. So a lot of questions regarding Medicaid eligibility, the dual plans, things of that nature.
All right, perfect. Is there anything else you want to tell people at home? I'm going to give you the floor to let them know what they need to know.
I would suggest not wait. When it gets closer to December 7th, agents and brokers get really, really, really busy for those that do procrastinate. So please don't wait. Talk to your agent now or call in this evening when we have the phone bank open. It's open from 4 p.m. to 6:30 p.m. Talk to a licensed independent broker. Ask the questions that you have, and if you feel a need to, schedule an appointment, and they'll do the review for you.
Perfect. Thank you so much for joining us this morning, Daryl. He's talked about calling in. You can get that number right there on your screen there. Remember, you can get those Medicare questions answered. This is during the annual Healthcare in the Heartland Phone Bank. Independent agents, they'll be taking your calls and answering those questions from 4 to 6:30 every day this week.